Welcome to another episode of Smiles in the Area podcast of oral health and prevention. I'm Celso da Costa, and today with me I have a really good friend today, Dr. Bastendorf. Klaus-Dieter, how are you, first of all?
I'm fine, and I hope I can give you good answers for the podcast.
For this podcast.
Yes.
The first one, and you know already, the question is tell me a little bit about your path on the dental world.
After studying dentistry in Tübingen from 1970 to 1976, working as a research assistant at the university, as an assistant in a private practice, and an internship with Professor Jan Linde in Gothenburg, I had clear goals for my way in my praxis. I didn't want to be part of a system of extractions and restorations. I had other goals for my own office. One was a general goal. Restorative dentistry must be replaced by preventive oral medicine. And the second was a private goal. I have 2 daughters, and my 2 daughters should never be treated restoratively in their lives through her father. And I can tell you, it's functioned. My granddaughter is 53, and Nadine, the dentist, 74. I have never treated them. Yeah? They have absolute perfect teeth. I started in my praxis in 1979 with 1 treatment room and 2 prophylaxis rooms. At this time, it was, for the most dentists, it was a way they can't go with me. When I retired in 2011, our practice had 3 dentists working in treatment rooms and 6 prophylaxis rooms with around 5,000 patients in recall. To summarize, it was a rocky way with many obstacles. We come later to the obstacles, but it was the right way, that I can say after now 50 years preventive dentistry.
For sure it was, because I take you as an example. But tell me, what is the role of preventive dentistry in keeping a good oral health? And also, what are the long-term benefits of it?
The answer is very, very simple. Lifelong oral health is only possible through primary prevention. There is no other way. If patients are primarily treated preventively and their oral health is maintained, so as a dentist, I don't have to worry about filling and restoration and material compatibility and resource consumption and sustainability. I also make a big contribution for my patients in her health, in her general health, not only in her oral health. In summary, this means the goal of oral medicine, long life oral health, lifelong oral health can only be achieved through prevention. There is no other way.
And by dedicating your life, your work life to prevention, you come across guided biofilm therapy, of course. So how did you implement GBT in your practice?
From starting in my own office in 1979 until to 1985, the Axelson Linde recall hour was integrated or adapted 1-to-1 in my prophylaxis concept. From 58 to 2005, hand instruments were replaced through piezo, and we use airflow supragingival with sodium bicarbonate. From 25 on, we used piezo PS and airflow with glycine. Now we used airflow subgingivally, and then since 2011, we have been working with erythritol. Now we can use the powder sub and supragingival. And in 2015, the systematic GBT protocol, which was developed in collaboration with AMS and SDA, with the University of Brescia, and with our office, it was integrated in our daily practice routine. In summary, I have always followed the technical and scientific progress and integrated it in my concept.
And in all your experience with GBT, How did it improve the patient comfort on the professional tooth cleaning?
This question we also ask ourselves. 1 year after integrating GBT in our daily practice routine, we did a survey with 50 patients who had been in the recall of our practice for at least 5 years. And from the last question, you can see we have always developed our system, but it's very surprising, the results. The most important question was question number 6. How did you perceive the treatment with GBT in comparison to the previous treatment? All 50 patients perceived GBT. They say it's better than the old approach. And our approach was not the approach of Linde Axelsson 40 years before. We have always developed, and it was so, for me, so surprising. I thought 10% may say it's better, but all 50% say it was better. And I have additional comments of the questionnaire. It was more effective, it was faster, it was gentler, it was unpleasant, very pleasant and without pain, sensational dental cleaning without pain, good feeling, much more pleasant, less painful, very pleasant. In summary, this means that patient satisfaction has improved significantly compared to our old procedure.
So taking all these benefits that you just mentioned, taking your experience, if you can advise the clinicians that are listening to this podcast and they are considering implement GBT in their practice, what would you advise?
The first we have to say is oral medicine is no longer possible without a prevention concept. GBT fulfills all the requirements of a modern preventive procedure protocol. In order to successfully integrate concepts into everyday practice, I have always taken a two-track approach. My employees have to take part, and I also, in training courses with external trainers. The SDR courses were recommended here. Even in my practice, also we help to develop GBT. We have had various training courses by SDA trainers. However, it's also important that internal training courses are held regularly. In these training courses, we discuss and train internal practice-focused topics and procedures. Also you need two ways, one from external and one internal. And we have yearly 6 internal trainings. Where we discuss updates to carriers, updates to PR, update, and so on. Summarizing, prophylaxis can only be successful in long term if it is offered systematically. It's for me very, very important. You need a system. The GBT protocol, together with training by the SDR, is a perfect aid to integrate prophylaxis into everyday practice.
Well, knowing you for some years already, you always tell me a lot of stories. But is there any super engaging story or the one that you record with most shares? And if there is, can you tell us how GBT play an important role?
Of the many successes we have, also with the questionnaire of the patients, the nicest story for me is a story of Mrs. S.S. born on 7th January 1978. She came to our praxis as an emergency patient in November 2019. She had big problems with periodontitis. In the emergency service, supragingival biofilm and calculus management with air flowing and with piezone and a brief consultation were performed. The patient made an appointment for more advanced treatment. We did non-surgical PA treatment, 2 fillings, and an endodontic revision. During the anamnesis taking, the patient told us that she has tried everything for over years to get pregnant. All therapies have failed. We explained to her, without giving her too much hope, the relationship between oral inflammation, in especially periodontitis, and general diseases, also fertility. And now the nicest is on the 12th of June 2020, the patient gave birth to two healthy twins.
Oh,
Yeah,
nice.
I don't know it's about GBT, but she is sure it's coming from her periodontal treatment with GBT.
Oh,
It's
that's a really nice story. So thank you for sharing already that one. And how do you see the future of preventive dentistry and how GBT can play a role on it?
Prevention is the most effective dental treatment that we developed in 150 years of scientific dentistry. Without prevention, there is no future in oral medicine. Both the WHO and in Germany, the DGZMK, German Dental Association, recognize this. They say prevention is a rescue parachute for oral medicine. A systematic protocol, and I can also repeat, systemic protocol is the key for success. A systemic protocol for the prophylaxis session is so important. GBT as a systematic, modular, risk-oriented, evidence-based, individualized, universal, also for complex cases, and applicable to all age groups, prevention and therapy protocol plays a crucial role. Dentists see, in addition to the professional way of doing GBT, also ethical advantages. More and more dentists are seeing these advantages. They say it's better to earn money from the health of my patients than from their diseases.
You were among the pioneers believing in the preventive dentistry when many others they didn't at the time. What kind of challenge you had in your work life with it, and what was the skepticism that you may have encountered on it?
There were many problems on my way into preventive practice. Professional organizations, universities, colleagues, and also patients acted again when I started my preventive way. I have a lot of problems. This culminated in the threat of withdrawing my license to practice through the KZV Stuttgart. They say this way is not the way for the dentistry in the future. You are sewing the branch, we are sitting on it.
Yeah.
The pace was difficult, but ultimately very, very successful. Today, Germany occupies a leading position in the international comparison of oral health. In young children, we are number one now. We are better than Swiss and Scandinavia and so on. In summary, I can say that my continuous focus on prevention has been difficult but successful. GBT is the right way, which we will continue to follow. GBT is a successful model worldwide and became even more important. And it's the same way I have to go. There are also for GBT, there are many obstacles. There are many universities, many organizations, and many colleagues who thought it's not the right way. But why? To describe this is a big problem, and I would like to end by questioning myself. It's easier to ignore a new finding than to integrate them in the treatment concept.
Klaus-Dieter, I don't know how to thank you because you really show the example in terms of preventive dentistry, and nothing make me more happy than the last lecture that I heard from you was at the ISDH in Ireland. And I need to say that having a full room, having all those people listen to you, knowing also your story and how it was difficult to implement preventive dentistry in Germany from your side, even having a problem with the association at the time, but never let down your values. I need to thank you for that. And something that really is close to my heart. That's why maybe I connected so well with you since the beginning, and just keep doing what you are doing. Because
I'm sure GBT is the right way, and we will put away all obstacles there together. And then...
No, for sure. And people
Yes.
need to know that you still practice for fun in the practice of your daughter. So this is something that is always nice to see how you are passionate as a clinician. So thank you for that. So once again, thank you for coming to the podcast and share your life story, your work life, and yeah, hope to talk to you very, very soon about more stories, not only these twins that came.
At the next we talk in a smaller group.
In a smaller
so I
group.
can do a little bit also in German to understand.
Well, we
me
are going
better.
for dinner today. We are
Yes,
going for dinner
okay.
today, so you can talk there. So
Thanks a lot.
to all the listeners, thank you so much for listening to this episode with Dr. Bastendorf. And don't forget to subscribe for this podcast in any platform that you are following us. It can be on Spotify, Apple Podcasts, YouTube, and even on the Swiss Dental Academy webpage, where we have a page only for the podcast season 1 and season 2. So don't miss the next ones. See you soon.